Hi, everybody. I wanted to talk to you today a little bit about multi-tier systems of support because it came up in some of the discussions in terms of response to intervention, and I wanted to give you the update on how we've transitioned in the field into multi-tier systems of support. So what is MTSS, as we call it? In Massachusetts is the Massachusetts Tier System of Support. Nationally is called the multi-tier system of support. And what it means is that it's response to intervention plus positive behavior interventions and supports. It's a instructional framework so that you can organize all the aspects of good, effective teaching into one framework that would guide you on what to do to support students. It increases efficiency and effectiveness, is preventive and responsive. It uses preventive approaches and intervention approaches for students, and it addresses academic behavior and engagement practices. It also uses data for instructional planning and progress monitoring, so it's data-driven and instructional planning. And this instructional planning happens through collaboration and individualized program design for the students who need it. Therefore, we address the whole child and look at how we will provide a comprehensive program that engages the child in the classroom. The aspect that you probably have heard the least about is positive behavior intervention supports, or PBIS. And PBIS is a very similar framework to RTI, but it provides strategies and instruction around behavior and social interaction. So it has the tier 1 is teaching the students the behavior rather than just telling them what the expected behavior is, having the students demonstrate it and provide reinforcement enough so that we know that the students can have performed it, and will continue to perform the behavior expected, whether it be in the hallway, the lunchroom, or the classroom. And then it's followed by those students that are unable, that about 70 to 75% of the class and the school who are unable to follow these strategies all the time, that receive tier 2 and tier 3 behavioral and social interventions, the most commonly one known as check-in and check-out. And it would, now you hear my dog, so that's always fun, and progress monitoring. So as I was saying, the idea of teaching behavior and providing additional interventions on the same format that response to intervention does, and monitoring data. This is not the scope of this class, so I'm going to continue on, but I wanted to give you a gist of what it addresses. So in a gist, MTSS is a school-wide system of prevention and intervention for all students rather than the wait to fail model. So as you've been reading in the assessment module on IRIS, we begin teaching, and in book reading, we begin by benchmarking the students 3 times a year or doing a universal screening, same thing, and then move into providing intervention for students who do not meet that initial screening assessment. So typically before, we would wait for October or November where the students would fail, and then ask for a team to come together to help you kind of figure it out with or without data. And so it was really the wait to fail model, and we would lose 3 to 4 months of instructional time during any academic year, making the students fall behind further and further every day that passed by. I have provided 2 links here to the videos, to additional videos and an article of what it is. And when you get there, look for any ahas that it might cause you or any questions that you still have. What we've learned in the last 10 years when response to intervention started was that academic achievement, social-emotional behavioral development are interrelated, and so we just can't remediate reading without looking at the whole child. We also learned that we can't put students in tiers, but that really the supports and interventions are in tiers, and students move across tiers depending on what they need at any given point, and that may change on any given point. We also learned that if our core instruction was not strong and it didn't meet 75% of the kids, our interventions were going to be too many, too disconnected, and they would not work. So we need to go back to core instruction and ensure that it meets about 2/3 of your kids, anywhere between 70 and 75%. And that's a good indicator of whether the kids are learning from you. So if you look at your class in a test and 2/3 of the class passed the test and 1 didn't, you're okay. If half of the class failed, and you may remember having these classes in high school or in college, then you need to go back and reteach and ensure that you're teaching it in a different way using universal design for learning principles so that you know that it access is available for all students. The next thing that we learned in the last 10 years from response to intervention is fidelity. And when I talk about fidelity, it refers to the way that we say we are going to teach according to what the publisher or the strategy recommends. One example I usually give about this is guided reading. And in guided reading, it's supposed to be given for every student 3 times a week. And typically, teachers adjust it to 1 to 4 or 5 times a week. And so the benefit of the program does not happen with fidelity for the students. Doesn't happen with fidelity, and so the students suffer because they're not getting the strategies that they're supposed to be getting in that small group format of instruction. What we also learn is that schools who do not self-assess their implementation don't continue improving. So that school-wide level of assessment, which again is beyond the scope of this class, is really key. And that level of assessment would dictate the district system supports that can be provided. But let's look specifically at the components of MTSS, okay? So I'm going to activate here the tier. And so you're probably very familiar with the 3 system tier, tier 1, tier 2, and tier 3. So one of the things that you will notice here is that every student gets tier 1 instruction. Oops, and I'm going to exit out. I don't know why it's running. But every student gets all of the instruction, academic and behavioral, evidence-based curriculum. And what we know is that 70 to 80% of the kids won't respond. In urban settings, that number's a bit lower. And so some of them, 10 to 15%, will need something additional. And that be in a behavioral intervention like check-in and check-out, or a small group intervention. And we also know that 5 to 15% will need something intensive. We also know that all students get assessed through universal screening 3 times a year. Those getting a second dosage of the tier 2 intervention get it monthly, and those that are getting intensive should get it weekly so that we're not missing any time. So what we're really talking about this is this paradigm shift that we began talking in class, going from the medical model to an educational model. So we don't wait till we're sick until we go to the doctor, but it's more preventive. Same thing in our classrooms. We prevent because we know what skills the kids should bring. So it also changes the paradigm of my kids, and those are your kids, but this is really all our kids because there are multiple professionals working to provide instruction and intervention. We take it from a reactive to a proactive and preventive through universal design for learning principles that provide more effective instruction. We also think about how we schedule the interventions within the day, not scheduling the students to go to places. And again, looking for flexible grouping, frequent and dynamic assessment as part of it, and collaborative problem solving. Some of the benefits if you do this are, of course, improved academic and social competence, increased attendance rate, positive school climate, and decrease in behavior, decrease in dropouts, and inappropriate referrals to special education. So the big difference here between response to intervention and MTSS, you see it in this chart, and that is that we're looking at the whole child. We're looking at the academic side of RTI and the positive behavior intervention and support side, and we're also adding engagement, and engagement defined more by culturally responsive differentiated instruction, academic skills, academic behaviors, a problem-solving orientation of the teachers, and strategy instruction. So what actually happens when you see a student that is needing that tier 2 or tier 3 intervention? And what we want the teachers to do is to look at all students and use the universal screening data, like your CBMs, and then your diagnostic data, like those formal tests you're administering, and begin by defining the problem. What does the data show you? Which is the area of concern? Then with your team, create a plan to teach it. You could talk about what tool you use to progress monitor. CBMs are always my go-to tool. And long and term short goals. How can we get them to end of year level if it's possible? Then we plan out how the implementation of the plan is going to happen. So who, what, where, when, and how often? How will the students be monitored? Do we monitor at instructional level and grade level? And those could be the same or could be different. And how will delivery of the intervention be determined and who will do it? So that everybody is aware of what happens. And then you reassess after 4 to 6 weeks. So any intervention begins 4 to 6 weeks, and then we're going to do 3 things, which is to look at frequency, intensity, or duration. And what do we need to tweak in that plan to make it better for the student and quicker for the student to gain skills? So again, if we go back to step 1 of the program, we define the problem. Is it academic or behavior or both? We identify cutoff scores. We identified who are the students needing tier 2 and tier 3. And then we look to monitor all the students 3 times a year. We then, for the students needing tier 2 and tier 3, develop some kind of protocol. And this is just an example of a time protocol so that you could talk about a few students in any given planning period, and you review core tier instruction, you review IEP goals or on English language development level, and then you're monitoring weekly that is happening as intended so that we know that what we said we were going to do is actually delivered. And then step 4, again, looking to see, whether the progress happened, and if not, what do we need to do in terms of frequency, intensity, and duration again here, and then restart the next 4 to 6 weeks of intervention. So as you look at MTSS in your school placements, ask information about and look to see, where the school is. What are the current strengths in providing this kind of structure to students? What can be the weaknesses or barriers? What could be some opportunities, and what could be some threats or potential solutions, so that you could begin to integrate kind of the information you're doing. And you could do it around reading right now and, kind of look at, based on what we're learning about reading, what do we know and what don't we know? Do they give a universal screening but no diagnostic tool? Do we give a screening and a diagnostic but the data goes nowhere? So think of where our content in our class falls for this process.